And I will pass it to Rita. Okay, Rita, you are now in control of the meeting.
Control. Oh my God. Yeah. Okay, let's see what I do here. First of all, it's so weird to talk with nobody looking at me. I would love to see your faces, guys. I know that everybody's super shy, and I understand that. You don't know me, but I can show my face here. Look, it's me, and I love to see yours. I just seen Manuela right now.
There's Anna and there's Natalie already.
Yeah, I don't see. Should I see everybody or
No, just the ones that want to connect the camera.
So I see here, for example, you is with a camera on. Anna, right?
Anna, yeah.
On. Micaela,
Yeah.
Natalie, and everybody else is kind of behind.
Off.
But why I cannot see those people? Should I?
Now no. Maybe because they don't want to show themselves.
Hello, I can see you both. I can see Natalie and Anna now. I'm happy because I love to talk, see people. It's really weird not to see people. I used to do some Instagram videos, yoga videos, and I didn't like it because I knew that a lot of people are looking at me, but I couldn't see who was looking at me. So I prefer at least looking at faces. Okay, I can see also here. Let me see participants. I think Micaela is on. Micaela is here, but she's not on, so that's okay. Yes, I can see you. That's okay that you're eating. Come join us. It's fun.
Can I ask something? My phone is getting out of battery. Can I change to the computer without losing the?
If you lose the connection, Anna, just
connect again.
Just connect again, and we accept you again in the room. That's not a problem.
Because I'm getting out of battery, and my phone. I have on the.
Yeah. But just connect again in the link, and we accept you again. Okay. That's no problem.
I will connect by my computer. Yeah. Thank you.
All right. So let's see. Okay, I got you guys. Good. At least I know who I'm talking to. Thank you guys for coming, joining us. Thank you, Micaela, for last minute call. I promise that I'll be promoting more the next webinar. This time I didn't have a chance, opportunity to promote too much. But thank you, first of all, Manuela, for you to bring me here. It's a wonderful pleasure to be part of that community, really. It's what we all need a lot. So what I'll be doing, I prepare a little kind of presentation for you guys. But before starting, I really love to make it a very interactive. I don't want you guys to think that I'm going to be lecturing. I don't want you to see as a lecture. I want to be a participative something different from here. I just prepared that slideshow that I can go through the topics, but I really want to kind of interaction, if it's possible. Even those that are not in the video, that I cannot see you, try to interact through the chat. That is more my profile. I really enjoy that, if you guys don't mind. Okay, so I'm going to start here sharing my screen. Let's see if I'm good on that. And you tell me if you can see it, okay? If it's, no, not here. Let me go back here. Yeah, desktop. Sorry, guys, I'm not very expert on that. Let me get back here and find my presentation. Here, open it up. Okay, can you guys see well, or?
Yes, we can see it well. You can put your screen bigger just for the presentation.
Yeah, that's what
Yeah, that's it.
Can you see it bigger now, Manuela, or not yet?
No, not yet. Yeah,
Now it's
now. Perfect.
okay, guys. So let me put, I want just to see the little faces right on my right side. Okay, the title that I decided to put, we were talking with Manuela about bringing a little bit of the yoga concept into dentistry. And the title we put is Mindful Movement for Stress Management in Dentistry. So that's a strong title, but simple if we practice that. So I'll try to go briefly through that, and through the slides, I would like you guys to raise your hands or just ask me questions and really make it interactive as possible. So let me move on here. I don't know why I'm, okay, here we go. Let me take this one off. Oops. I'm terrible with this stuff, guys. Okay. First of all, my view of pillars of health. This maybe it's something that universal, maybe not, but that's how I try to figure the health in general is through those specific points. The nutrition, when you talk about nutrition here, it's not just actually what we eat, is the diet in general, not what the healthy fruits and veggies and antioxidants and water is, the diet in terms of general diet, what you're really receiving from your senses, from your ear, from your eyes, what you're listening, what sort of news you're choosing to digest. So that's the nutrition that I consider part of our health. Sleeping, basic, even though it's not long hours, that's the quality of sleeping that is basic, that you guys know too. Movement and stress management. Those two things, some people kind of disconnect that, the exercise with the stress management, but it's totally connected. Actually, all of those 5 pillars, they are all the structure of the preventive and health in general. And the community, this is something that you see down here, just 3 of us. We now 5 showing up, much more that are not shown, but that's why I'm here. And that's what I think that more than ever today should be considered as part of health. We need that sensation of belonging. We need that sensation of community, teamwork, even if it's just with 2, but that strength that put us together. And that's what really motivates me to be part of the Manuela team. And hopefully we're going to be working more together because of that. And just a little something that I want to add about the community. There are some researchers that were talking about love and what is the importance of being loved. And they came out with that really surprising results, that the sense of belonging is more important than the sense of being loved. So this is just a little tip, how important it is to create that community and to be part of a community, whatever community you choose to be, but that sense of belonging, maybe sometimes bigger than being loved sensation. Moving on, why and what is mindful movement? Mindfulness, I don't know, and I would like to ask before we going through that, you guys that are showing up or the ones that I cannot see, what is your relation with mindfulness? Just as a curiosity, you guys have any relation with Manuela's workshops and Manuela's course, or you've been doing some yoga, or you're just curious about the whole thing? Can you kind of give me a little tip from you, your experience?
Hello, this is Anna.
Anna, yes.
I'm curious and I would like to start practicing. So I heard about Manuela because I have a friend in Belgium that made already a course with Manuela.
Oh, great. Where are you located, Anna? Where in the whole world are you located?
I'm from Portugal.
Ah, okay, great. Muito bem. Great. Anybody else that wanna just share a little bit the curiosity or why you guys here now today? That's okay. Okay, I think we are here because we have some certain level of curiosity, and mindful movement is basically is a mixture of mindfulness, that is the presence, be attentive and be present in the moment. Meditation, that is, I don't know your level of meditation, if you have any practice of meditation, but it's all that mixture of meditation, presence, movement, breathing, and some relaxation exercises. So I'm putting here because the mindful movement, the name itself, people could get confused. And we are going through that later on through the slides. I'm going to explain a little bit more. But before that, the father, what we consider today the father of mindfulness, is one of, okay, he's actually, he's 94 this year. His name is Thich Nhat Hanh, and he's from Vietnam. And he believes that mindfully moving is us. We are moving creatures. We never stop. Even if we're laying down and sleeping, we're still moving. We're still in action. We're still transforming. And he believes that the peacefulness from inside comes in every little step that you take. So he's the one that started with the mindful movement. And he was teaching, he's from Tibet. He was a Tibetan monk born in Vietnam. And he's still active on doing that mindful movement teaching. So I just bringing that up a little bit to get at the background of the whole idea of mindful movement and why all this related to dentistry. Why we relating mindful movement, dentistry is more than urgent that we take care of our bodies. Here, I'm just showing here. And actually, I'm not too much into specific researches and numbers that we guys maybe are tired of all these numbers. So I just put in one here to show physically the stress in dentistry, physically. We have a lot of other stresses, but physically, you can see the numbers here, shoulders, neck, and head. Those are the trigger points that practically in a dental chair, you're activating those areas. So you can see it's very high. So it's extremely necessary to improve our posture. It's urgent. And what happened, most of the times we are not aware of our posture. We are not present in our bodies. So to prevent any later on chronic musculoskeletal disease, we really need to be aware of the posture. And then comes the mindfulness. The mindfulness, the presence, the awareness comes together with the awareness of your posture. So this one is just to give you a little insight about the urgency that we really need. And though a lot of people don't know about it, they just get into the habit of doing the same thing every day, all the time, and don't get that awareness of the body. So what we're going to, from here, what I'm going to ask you, do you think I'm going to ask you to do those posture in your office? No, forget it. This is the image that people have, the concept of yoga, the concept of how you're going to practice those crazy postures. I'm not asking you that for sure. I just want you to get you into your own reality, in your dental chair, in your clinic. So what before getting to your clinic, before getting to your dental practice, what is yoga for you? So sometimes, and maybe what they selling from outside, yoga are those beautiful ladies with their perfect body doing that perfect movements, and it's what they are selling, right? But no, the yoga itself is union. The name yoga means yug. Yug means union, and union of your body, your mind, and your soul is 3 in 1. So that connection, that union is unique, is just yours. So what we see from outside, what they try to sell us is that crazy postures that we can do, so we cannot do it because it's not your body. Maybe you can do it because you're flexible enough, but it's not the reality. So before getting into any mindful movement or yoga in dentistry, whatever, I just want you to guys clean up that image of the yoga and bring up a new image of yoga as a union, your own union by your body, your mind, and your spirit. Is yours. It's that practice. And going from there, the yoga itself is not just the postures. So yoga, I like to compare, and here the picture shows like a lotus flower with the petals. And that's beautiful, and I love that. And actually, the logo of my company, my logo is a part of a lotus. I love that lotus. But I always like to bring up as an onion. You guys, I don't know like you like cooking or not, but if you cut an onion, you see in the onion a lot of different layers. They are all interconnected, but have different layers. So I see the yoga as an onion and all those different layers of the onion. So today I'm not going to get too much into that. This is another chapter, another course of yoga. What I'll be focusing more today, talking with you guys between the asana, that are the postures itself, the physical exercise, the one of the layers, the niyama and the yama. Those are the, if I can compare maybe to the 10 commandments, like the ethical rules of yoga. And I'm going to be focused more into this one, the niyama today, is the discipline of doing it. And also today I'll be talking about the pranayama, that is the source of energy, is the breath control of the whole picture. So it just keeping there is already yoga. So when we talk about yoga, it's not just the asana. That's important to know, is the whole big picture. Today we're going to be more focusing to that one. So why I started that. It's a little bit about me that I didn't talk too much about me, but I wanted to bring in here. I've been a dentist for maybe 32 years ago. I graduated in my dental, São Paulo, Brazil, OSEC, and I practiced few years. I had to give up my dental and that was something that I couldn't really control. It was just part of my life. I had to give up dentistry to follow at the moment was my husband, and I decided to follow him through the military. So I was moving all over the world. I was like a US Navy spouse. That was my profession. So I took off my dental clothes and I put in my military uniform and I just moving through the world. So through that journey, I found Yoga Fit. I was teaching already in a fitness center, and I was teaching Pilates. I had my certification in Pilates. So I started kind of finding interesting the concept of yoga, and Yoga Fit fitted me a lot. And those, I just put it here because I think it's important to know the essence of things when you do things to get to the basic. And actually, when I teach yoga, I always go back to the basics and the positions and everything. We need to always go back to the basics and get the essence. So the Yoga Fit essence talks about breathing, about feeling, about listening to the body, competitions, not competition, and letting go of the competitions, letting go of any judgment that you have with others and with yourself. Any kind of expectations, because when you expect too much, you get frustrated. And the thing that really connected me to mindfulness is the staying in the present moment. So those are the essence, the Yoga Fit that caught my attention. And what about the foundations of mindfulness that me and Manuela, we share that. We coming from the same school. We did the same Center for Mindfulness, the University of California, San Diego. Those are the foundations. So what I put together here, just for you guys to know that, like the coincidences, in a way that I was searching my journey through that. So the foundations of mindfulness and the essence of the Yoga Fit, they fitted so well together. So it's one more time, just kind of confirming the importance of the relation of body and mind. So officially, the Center for Mindful, the University of California, San Diego, and the Yoga Fit have all these in common. And I just want to go through that, and maybe it sounds kind of out of topic, but it's not. And it's going, and you're going to get there. No judging, the patience, beginner's mind here. What do you mean beginner's mind? Means you're curious about learning all the time. You kind of being a child all the time. Trusting on the moment, trusting in life, how it flows, whatever comes, just trust. No striving, not expecting, not really grasping into anything that comes. Try to let go. Comes with the acceptance of letting go. And being generous about others and yourself, caring about yourself, taking care of your body, of yourself, and the gratitude attitude that is there all the time. So all these relating to the essence of yoga, in that each movement that we do during the life, each step that we take, breathing consciously, feeling that moment, listening to the body, and letting go of competition, expectation, and staying present in the moment. So now we're going to get back to your own reality, the reality of the office, the dental clinic. Let's think about you, each one of you. What is your biggest concern in your dental clinic? What is your reality in your profession? Not just physically, mentally, spiritually, where are you right now? And this is a question, I'm not expecting any feedback on that. It's just like a kind of brainstorming. What is your reality in your dental field, in your practice, in your family, in your social life? I don't know about yours, and it's very personal, but I know that we all have something in common. That is our unique human body. There is no way out. That is our common humanity. And even though you have scoliosis, you have hernias, whatever you have in your back is your body. We are all the same. There is no other way. We are not ETs from outside world, and that's our reality, our unique human body. And I'm just putting that thing here because especially lately with the ergonomics, a lot of different options of new kind of settles tools to sit, and with arm, without arm, with back, without the back, what is good, what is bad, all that technology coming up, and that's amazing. You have all different colors and styles and size and prices of different kind of settles tools to sit, and that's great, and that's I love it. I think it's great. But coming back to that awareness, if you have all those tools, but you're not aware of your body, your own reality, what are you going to do with that? In your body, there is no way back. There is no refund. There is no warranty. You pay once, that's what you have. So you better take care of that because that's unique. It's all yours. And you have to hang on that for all your life. What about this posture here? The picture, is that familiar to you? You know that a bad posture can really cause mental and physical stress, not the physical, just physical, because later on we're going to go through the cycle of the stress, but the posture is causing, we think that it's just physical stress, but leads on into a mental stress and increases specific hormones. And one of them is the hormone of the stress, considered the hormone of stress, the cortisol, increases high levels of those hormones. So that is going to lower your self-esteem, you're willing to do things better. And because it's a physiological action, it's not just because you're not in a good posture. It's actually activating hormones in your body that is going to release all the hormones, and your low self-esteem is going to start growing, and just you don't feel good. And that goes around. And I usually show here, let me go back to the cycle here, the cycle of stress. If you don't put a stop in that cycle, that's the stressor, okay? Let's suppose the stressor here is your position. You're staying in that position for hours without moving. So that would be your stressor. What happened? If you don't change the reaction of that stress, you're not changing your posture, I'm talking about physical posture now, it's going to have a negative impact on your health, whatever it is, now or later. You're going to be paying for that. Increasing all that sensibility, decreasing the productivity, and creating more stress, and then non-stop. That goes on and on. So we need to have a stop somewhere here. We put the stop sign. And what I'm offering and what we offer, we try to offer, is the yoga. Let me get back here. Is the yoga. Why? Because if you don't take care of the position of your body, you're causing ischemia on your muscles because you prolong time in that position. So with that prolonged time, plus all the emotional stresses, the visual changes, everything that comes together with that posture, you're provoking ischemia on the muscles. And this is triggering inflammation. The inflammation is triggering problems later on. Could be right away because you're feeling, oh, my neck pain. Or maybe it's just triggering a chronic disease, a myofascial pain syndrome, musculoskeletal disorders, neck pain, hernias, all, you name it. And it is going to come, even though you don't realize the day. So it's like for sure will come if you don't change your posture. So in dentistry specifically, the trigger point, the trigger muscle that is present right there, and there are many, but the ones that are more active is the trapezius. The one that we're talking that is shoulder, neck, and back is right this. So where it started, where it inserts, so all those fibers, they are constantly working in your position, whatever you're doing, constantly, non-stop. So that's why I'm showing that anatomy, why I'm showing that, and why that's so important, because comes here the mindful movement. Yoga is a mindful movement. It's almost the same. We don't say the same because mindful movement could be a lot of other movements, like, for example, Tai Chi Chuan or Qigong or mindful walking. There are other options of mindful movements. Now, today here, since I'm a yoga instructor, we're going to be talking about the yoga into your reality. So all these things are beautiful here, lined, but they are true. They are comproved. They are research. They lower stress level, as I said, the cortisol goes down with improving your movement, increasing our flexibility, improves your lung capacity with the pranayama, with the breath. You actually physically improving and expanding your pulmonary capacity. Lowers blood pressure, reduce any chronic pain because you're reducing the inflammation. So you're not going to lead to a chronic pain later on. Releases the anxiety, improves sense of balance of the movement because you're understanding and balancing out the muscles of the body, and the fibers are finding their way to establish your position, your posture. The self-awareness comes with the mindfulness, because just exercise is great, but exercise without mindfulness is more like a habit. You just do it for do it. You're not really thinking, you're not really present in the moment with that exercise. So the increased self-awareness, because yoga, it is a very mindful movement. You have to be present with the breath and knowing what you're doing. Builds stronger bones, calms the mind, especially specific because of the breathing. You're giving space to the mind to calm down. And all these goes around. So those are real proven benefits of yoga. What about the stretching? Because in yoga, what we do most of the times, we stretch. We do a lot of work too. We do a lot of cardio in yoga. Depending on the kind of yoga that you do cardio too. But stretching, what they do basically, they release the neuroendocrine factors that are endorphins, for example. So they are extremely important to do the stretches. Even if people do, oh no, I do stretches, I do that stretch, I push my arms up and down and the other arm up and down. That no, you need to do that mindful stretching to be able to stay in that moment and give space and time to your body to have that moment of releasing those neuroendocrine factors. Otherwise, you don't give time enough for the body to react. You're just doing for doing. So you need that time and space to allow the body, with the wisdom of the body, to release those factors. Let me move on here. Wait. Are you there with me? Yes, I don't know if everybody's there, but I can see some faces there. Okay, about researches, a lot of researches. I'm not going to go through details. You can Google that on internet, but just little tips of researches in terms of, for example, in this one about the anti-inflammatory factors in chronic low back pain. What dentists that don't have a back pain? That's totally real. Upper back, middle back, lower back is always there because of the anatomy is natural and the tendency of folding over the patient. So that's a reality. What about, for example, here, there's another one talking about the psychological distress. We deal with a lot of stresses in the daily routine. Patients already, especially nowadays with the pandemic, everybody's in a level of stress, a very high level of stress, and you are the one that is dealing with that. So it is very therapeutic for you dealing with yourself, with your psychological distresses. And from that, if you're dealing with yourself and knowing how to handle that physically and emotionally, those psychological distresses, you'll be able to handle your patients, your staff, people that work, the teamwork, your family. So it's all researchers, all based scientific proven researches. Yoga practice, health status, health behavior among yoga practitioners in Germany is another very good study that I just found out here. And sharing a little, one more, just that posture yoga and mental health promoting too. The posture yoga, that's what we're talking about. It's just being attentive of your posture. During the day, during your cooking, during your patients, you're present with your body. You are aware of your body right there. So now, are you guys ready to do some practice? I told you, I like to interact. And the mindfulness, without a practice, we cannot do too much. And I love that phrase, the practice put brains in your muscles. And we need to put brains in our body. We kind of disconnect sometimes. And as a dentist, although I'm not practicing for a long time, we are kind of educated. We kind of focus to be very strict and very precise and very, sometimes I could say even narrow-minded, very, very squared. So we need to put movement on that squareness. And the mindfulness brings us that idea of open up a little bit out of our comfort zone and embrace yourself. And then comes the foundations that I was talking about, the gratitude, generosity, what does it have to do? Yes, we need to take care of ourselves. We need to embrace ourselves and be gentle with ourselves. So why I've been creating that for a long time, the mindful dentistry program, to bring that awareness to us that in that field, that we forget about taking care of ourselves. We take care of the patients. We need the best care of the patients for everything else, but not ours. We forgot about our body, our position. So putting together mindfulness, yoga, and dentistry, and we are going to be practicing some. I would love to see you guys, to be able to see how you're moving. Since I cannot see, because a lot of people are shy and they don't want to show up, and that's okay. So what I'm going to ask you, even though you're not there with me, seeing, I cannot see you, I will ask you now to get a place. I don't know if you're sitting in a chair or in a sofa. Just I'm sitting in a regular chair. I want you guys to sit in your regular chair, whatever chair you are, but be present with the seating. Let's pretend you're sitting in your settled stool, the chair in your office, whatever you have. So just feel your presence there. Even though it's 9 o'clock in Spain, I don't know what time is in your country. It's late, but pretend that you're sitting on your chair, because this is going to be your home practice for tomorrow. I want you guys to put in practice what I'm talking today here. So sitting, and you feel like you're sitting, your sit bones seated, and you have your foot grounded on the floor. So you're not with the top toe, the whole feet grounded. If you have high heels, I doubt it that you're having high heels, or just whatever you have, just feel you grounded, back straight, okay? And I'm going to put here, just for fun, and later on, if you want it, I can send it to you. So you just ask me. I'm going to put music that I really like because it's not too much Zen, but it's not too high. So it's something that you can flow. And the idea that I did that for you is to put in your practice, to bring it to your office and have it. I'll tell you how you're going to do that tomorrow. I want you to really practice that tomorrow. So what we're going to do, you're going to follow the breath with me. And before anything, just going to keep with the breath first before moving. So inhaling through your nose, 1, and exhale out. And nose, inhaling through your nose and exhale through your nose. Keep on doing that with your breath. And exhale. And every time we exhale, feels like you're really releasing tension of neck, shoulder, facial muscles. Inhale nose and exhale nose. Just giving that space for you to feel the breath on your body. Now we're talking here about the pranayama. So we are actually doing a quick practice of pranayama, just the breath, the awareness of the breath in the body. Inhaling, feel the expansion of your thorax, of your chest, of your side. And as you exhale, you actually feel the contraction, but maintaining the back straight. Keep on doing that. Inhaling and exhaling. Good. I cannot see your faces, but if you want to keep on doing that with your eyes closed, go ahead and do it, because the whole idea here, and again, I'm not going to be teaching you. I'm just kind of guiding you to have the experience that it's just yours. Mindfulness, yoga, dentistry is your experience, not nobody else. Keep on moving, air in, expanding chest, back, and exhale through your nose. Allowing every exhalation just to let go. Remember the foundations that I talk about? Letting go of any expectations, what I'm going to get after that. Forget it. Just be present right here, right now, with your breath work. Good. Now I'm going to invite you to open your eyes if you have your eyes closed. And I hope you can see me here. Very simple. And you're going to be doing that tomorrow between patients. Just bring your shoulder up. Inhale. And exhale. And release it all the way down. Left one up. Inhale. And exhale all the way down. Inhaling right one up. And exhaling down. And if you really go slowly and use your breath, you're doing that already. You're teaching your body. You're allowing your body to heal itself because you're using that antagonist muscles, the agonist and antagonist muscles to do their work naturally. No effort. But do that with your mindfulness breath. So inhaling, stretching up and exhaling, release it down. One more time, right and left. Good. Drop it all the way down. Feel the weight down now. You have your arms softened to the side. Good. Now bringing your arms slowly, reaching to the side. Open it up to the side, palms facing up. Slow movement. Inhaling all the way up. Take a deep breath. And exhale, slowly release it down. And again, if you want to keep your eyes closed, just to feel that movement. It's all your body. It's all about your movement. The only thing that I'm asking, get back into your breath. Inhaling, stretch up. Exhaling. And as you do that movement, your body is doing that for you. Your breath is doing that for you. It's a healing process, natural healing process. You're allowing those fibers of those muscles to activate and to release all the inflammation between the fibers that probably you're kind of tense without knowing. Keep on doing that. Inhale up, exhale, release it down. Just one more time. Maybe you start getting tired, but it's a healthy tiredness. Release it all the way down. Good. Soften shoulders, soften your head a little bit. Give that time to find your neutral position, always getting back to your basics. Good. Now we're going to bring both hands together. We call that praying pose. So what means? It's not just putting hands together and you stay here. It's very active. You're really putting fingers, connecting fingers together and palms of your hands together. And active arms. So we have very active arms here, not dropping back. Still seated, just very active arms. You're connecting muscles here with your pectoralis in the back. And you at the same time, in yoga terms, you are exchanging energy from one side to the other of your body, of your brain. And from here, we just moving, maintaining the thumbs right on your center. Very easy to move. So just maintain your center. And you move, inhaling to the right and exhaling back center to the left. Inhale. And exhale back center. Inhale right. Exhale back center. Very slow movement, no hush. And that's okay if you don't go too much further. It's your body, it's your rotation, it's your own twist. Nobody better than you to know your limits. And then comes the non-expectation. You're not expecting anything. You're just allowing your body to move fluidly. One more time. Center, left, inhale. Exhale back center. And find your center again. Good. Release shoulders, release your arms back down. Soften your shoulders again. Good. And this one, we did a little bit of twisting. So that twisting, we are actually moving not just the muscles, we're moving the back too. Now we're going to stretch arms up. Keep that good, nice stretch up. And as you move now, you're going to open your arms to the right arm to the right and left arm forward. So you're kind of twisting to the side. And from here, you cannot see me very well, but from here, you're going to drop your right hand to the back of your chair. If your chair have a rest, great, you just put it on the top, otherwise. And then the other hand, the left hand will be on the top of your right knee. So it's a good twist right there. And you're going to be facing all the way to the back. Just hold it there, stay there, and get back to your breath. Feel the breath on your chest, on your side, on your back. Feel the expansion. You're really actually physically amplifying your pulmonary capacity that we all so much need nowadays, more than ever. Feel the breath expanding your ribs. Exhaling and just maintaining that good, nice twist, facing towards the back. Another deep breath. And slowly exhaling back. Go slow, feels like a slow motion film, and get back to your sitting. So get back to your basic, release shoulders. And in the office, when you're doing that, take off your, anything that is kind of limiting your movement. So just take that space for the body. Let's do that again. Both arms up, inhaling. And as we exhale, moving to the other side. Right arm forward, left arm to the back. Release the left hand back to the back of your chair. And bring your right hand on the top of your left knee. And feel that good twist from your sit bones going up to your hips. All the way up to your spine. Releasing tension on your shoulders, facing, actually looking at the back. And holding that pose, just maintain the breath. Keep with that breath in and out. Being present right here, right now. Deep breath in and out. Another deep breath. Really feel the breath on your chest. And as we exhale, slowly move it back forward, facing forward back to us. Shoulder released. Good. Now, your hands. You're just going to we're going to say high five to each other. So you're going to press your hands forward. So you're stretching your arm. Let me move a little bit further. So you're stretching your arm and just flexing your hand in a way that you can use the other hand to pull your fingers towards you. So we're just holding that hand right there.
Rita, desculpa, é que a Ana, sorry, I'm speaking Portuguese. Anna sent me a message saying that she's trying to get in and she cannot. You have to accept her.
Oh, yes. Thank you. Yes, I'm allowing Anna to get back. Here. Thank you for telling me.
Yeah, she sent me a message, but I just saw it now. Sorry to interrupt.
No problem. Yeah, because I didn't realize that. And also I allow Eunice. I don't know who is Eunice, but welcome back. Anna Eunice, welcome back. We are here in the right arm, stretch, front shoulder, stretch your arm, and just flex that hand and bring your left hand and kind of pull towards you. Can you see close? Yes. So just hold it there. Simple. Back to your breath. Inhale and exhale. Hold for 3 breaths in here. In and out. That's scientifically proven, guys. Just that. Every day. 10 minutes is enough. So let's change now. You change the rotating. Your hands are like that. You're just putting back down. And you're doing exactly the same. Put the other hand, the left hand, on the top of the right hand. And just maintain the arm straight. And just hold it there. Simple as that. Just get back to your breath. In and exhale out. Breathe in. Breathe out. One more deep breath in and out. Good. And release it down. Soften shoulders. Take a time to get back to your pose. And let's do again with the left arm. So straight arm. Bring your palms. Flex your palm. And with your right hand, you just press your fingers towards you. Good. Remember, doing that just by staying here. Very passive movement. You're releasing a lot of neuroendocrine factors right there. Your body's wisdom is being activated. I used to say that we open up the pharmacy inside your body. You don't need to buy anything from outside. Get back to a deep breath. And we're changing again. That hand down. You're just feeling now here, you're stretching the upper part of your arm. Use your right hand to press against the fingers. Maintain that straight. Get back to your breath. In and out. Just being patient with your body. Allow that breath to do the job. Good. Another deep breath. And exhale and release it down. Soften your shoulders, your neck. And just find your sitting position again. We lose track of that. Back straight, the crown of your head up to the sky. Release shoulders. Good. Now we're going to move simply, just that. Right here, down to your right shoulder. It's very easy that we use that effort of the shoulder up. So we're really allowing the head just to drop down to your right shoulder. Sometimes we kind of let it drop forward or let it up to the back. Try to make like invisible wall in front of you, in the back of you. So you just make a lateral movement here. Hold it there. Breathe in and breathe out. And every time we exhale, use the exhalation to drop and let go. And you know what happens when we inhale? We are activating our parasympathetic nervous system, releasing relaxation factors, hormones on the body. So just with the breath, inhaling, exhaling, and softening it up. So we're softening, we're really activating all those muscles on the side of your neck. Another deep breath. And with the breath, inhale, get back, center. Feeling the difference? You feel actually in the body. Good. Just with that exercise, let's drop down to the other side. Feels tight, especially after end of the day or between patients, feels tight. And that's why you need to do it. Give that space for you. Keep it down. Keep your ear down. Make sure you not bring your shoulder up. Keep it down. And back to your pranayama, back to your breath. Allow the exhalation to really physically and consciously release tension. Good, another deep breath. Usually you count 3 breaths in each pose and get back, center. Good. Find your body again. And another simple one. You have that line here, very simple. You're going just to move your chin forward. Move it forward. Feels funny, feels weird, but that's very important. So feel goes forward and exhale back. Inhale forward and exhale back. So you do that in your own body. Just try to feel the range of motion on your neck. So simply by doing forward and back. Usually we try, it's unconscious movement, to use your mouth and open your mandibular. Just try to make all the movement of your neck forward and back. With the breath again, in, exhale back, and release it back. Good job. One more, both arms up, stretch all the way up. Let me go back, then you can see me a little bit better. So what you're doing here, you're just folding your elbow, folding away that your lower arm is not dropping down. So you have that angle, the right angle here and here. So simply like this. And we're going to bring your right arm around your left. And you just crisscross the arm. So bring your right around your left and crisscross. Feels funny, and it's funny. So what you're going to be looking right on your center. And you're just holding. If you can hold your hands here, great. Otherwise, just maintain a way that you maintain those arms the way that you can. I cannot see you, all of you, but try to do the way that you can. There's no right or wrong. It's your body. So hold it there. Inhale and exhale. And actually, if you stop to listen to the body, you're going to see the fibers working right there. You're going to see with your inner eye. Allow the body, allow the breath to feel that stretch. Another deep breath. Exhale. And release it down. Drop it down. Soften your shoulders. Release your neck. Good. Now we're doing the same now. Both arms forward. Remember, you did the right arm. Now you're doing the left one. Bring the left one around. Cross it. Keep your side right on the center. Just facing right on the center. Little hole right there. Don't drop it down. And just stay here. Breathe in deep and breathe out. And actually, you can do it. During the patient, we can be talking with the patients and just keep that position. They think that you're kind of weird, but why not? You can establish a new relationship. The patients will learn from you. That is important to take care of yourself. Get back to your breath. In deep. Exhale, hold. Another deep breath. And release it down. Soften your shoulders, neck. Good. I'm going to just show one more exercise for you that I want you to practice tomorrow. It's all about all the back. So what you say, sitting on your chair again, you're going to slowly bring your navel a little bit towards your back. Let me go to the side. Maybe you can see me better from here. So you're going to kind of bring your navel towards the back and allow the weight of your head down to the floor. Your hands will be on the top of your leg. So you're just curving your back all the way to the back. Allow the weight of your head, the bowling ball of your head, all those kilos of the head down. Keep your navel towards the back. And really allow the breath to move in and out in that position. Feels difficult, but just allow to stay here. Another deep breath. And next time as you inhale, you start moving your chest forward, press your hands against your thigh and bring your chest forward. Chin up to the sky, shoulder to the back, and allow your head to go all the way to the back. So stay in that pose. If I could see you, I could be checking on you, but you can check on yourself now. You have your shoulder towards the back. You're feeling the stretching on your throat actually. The weight of your head back, chest open. Taking a deep breath in and out. And slowly you're going to move, transition back to the same posture as before. So first, bring your chin back to your chest. Start moving your navel towards the back and dropping forward your head and really moving all the vertebrae. You're really kind of opening space between the vertebrae on the back. Get back to your breath again. Hold that position. Another deep breath. And exhale, slowly moving. Chest forward, shoulder to the back. Head up, chin up to the sky. Drop your head to the back. Open the chest. You're physically opening your chest area, your heart, your compassion. Physically, you're developing and practicing opening the chest and with the breath again. And at the same time, you're really moving all the vertebrae of your back, oxygenating, bringing energy, putting health in your spine. And from here, you're going back to your neutral. It's important to find your neutral. Where is your neutral? It's your body. Just find your sitting again, finding your neutral position, softening. Good job. That was great. That was just a simple sequence of exercises that I kind of designed for you to make it very easy to, somebody's asking me to, no, to make it very easy for you to practice at the office tomorrow. So what I can do, if you want it, I can send you a mini video with those movements. Then you can actually put in between one patient, maybe just one patient that you have between one patient and the other, just that one, 5 to 8 minutes. Today I was a little bit longer because I had that time, but you can do that 5 to 8 minutes. Good, thumbs up. Are you guys there with me?
Anna is saying, yes, please.
Great.
She doesn't have a camera on the PC, but she's here.
Yeah, what I'm going, let me put here a slide of tips that I want to give you guys. Okay, this is simple. 3 breaths between patients. That I'm not asking too much, guys. That's simple, easy. But it's not just I'm breathing all the time. No, the mindful breath. So being really conscious about the breath. So stop between patients and just close your eyes if it's necessary. Tell your assistant, I'm taking my 3 breaths. Wait. Close your eyes and just take full deep breaths in and out. I put here, set a time or music that maybe for you, fits for you, to put in your phone that specific time to do it. Just stop whatever you're doing, do it. And maybe a quick music that you can just put to remind you to do it. So rechecking the posture with your patients, what I figured to a way for you to realize if you're in a safe position, closer you get to the patients, better position you are. Otherwise, you're going to be using this movement of the neck to get closer to the patient. So bring all your body closer to the patient. That will help you to maintain your posture. The mindful movement video that I can send to you. So please message me and I send it to you to your email or WhatsApp, whatever way is better. It's simple, very simple. It's not professional. It's very made from my heart to yours. That brings you some awareness of position mindful movements into your practice that you can use it tomorrow. Okay. I put it here because I'm always having my water with me, and that another lot of researchers on that we need to maintain that hydration of the body with the intense breath that we're using all the time in the movement. So keep yourself hydrated. And another thing that I just put here that I was going to forget to tell you, you are welcome. You are my guest. Usually I charge for my classes, but I want to invite you guys that are here today to join my class. It's not specific for dentists, but I have a lot of dentists in my classes too. So I trigger muscles and specific poses that will help you out. So join my online live. It's not a course, it's not a record, it's a live class that you can join, and just I welcome you to come. So I can message you later on with the time that we have available. All right. So I think we are over the time, right, Manuela? Or
Yeah, we are. If you stop sharing your screen, maybe we can stop recording, and maybe we can just see if there is any questions or any or if we talk a little bit more. I'm going to see if I can stop the recording.